Hello, everyone. Can you all hear me? You'll have to type. Can everyone hear me? Okay, great. So, did all of y'all attend the webinar yesterday, or did y'all see a recording? Is there any question y'all want me to cover? Anything about yesterday that y'all have had thoughts about? Anything? Or should we just go ahead with the rest? Okay, if you have any doubts, please feel free to use the chat box, and I will try my best to answer all your questions. I'm also learning, and I'm also in the same journey as you all. But if I do know the answer, I will surely help you. So we did the case studies yesterday, and we had done one where I had prescribed amyl nitricum because of goiter from sadness. And I showed you how the patient had the anxiety, the palpitations, the hypertension, the diabetes, the slight what to say, puffiness of the face and the swelling of the face. So, and I also showed you a similar one with, sorry, a similar one which we give cactus. And see, these were cases that we did with students around us. So in the second case, everyone thought I would be giving them Natrimur, and it looked like a Natrimur case. But when we know these small indications, it becomes easier for us to prescribe something which is on the mental sphere, but at the same time, it does cover the pathology much better. Okay, so this particular series of the webinar on thyroid is mainly for you to find those small hidden gems that we have in homeopathy and how we use it in our practice. Yesterday, I had asked a question on whether we prescribe on the constitutional way or the anti-miasmatic or a pathology specific. Did anyone get some insight into it from yesterday's webinar? Would anyone like to share? Okay. I think I'll just go ahead. So all the cadmium salts are actually very good for the layer. If it is prominent in thyroid pathology, then pathology specific for whichever symptoms are at the surface. Yes. And we have constitutional and the miasmatic prescriptions. But when this particular remedy covers the mind and the physical complaints together, and we cover the physical complaints beautifully along with the mind, that remedy will become the constitution at that particular time. Yeah. Yes, Nisha, I agree with you. Yeah. So cadmium. So cadmium was a remedy which, in fact, Clark and Grimmer wrote a lot about, because they started using cadmium a lot in remedies in patients who had history of chemotherapy or radiation. And here we use it if the person has had a history of radiation to the thyroid, especially in these cases of hyperthyroidism, where they give radiation to reduce the overactivity of the thyroid gland. You can give cadmium iode if it is indicated. Now remember, cadmium is a very, very chilly salt, and iodine is a very, very hot salt. So you're going to find it very similar to merc, because it'll be like the barometer. It will have excessive sensitivity to cold as well as very excessive sensitivity to heat also. And the iodine component will give intolerance to hunger. So they might say, oh, I don't eat a lot. But then if you ask them in detail and you tell them, no, but then when you get hungry, can you tolerate your hunger? They'll say, no, that time we cannot tolerate our hunger. We don't eat a lot, but we cannot tolerate hunger. So that is also cadmium iode. Calcarea carb. Now, calcarea carb, I've written very little over here, but it is I think it is constitutionally a hypothyroid case. Besides the means the increased perspiration that you see, you can see all the symptoms of hypothyroid: the weight gain, the chilliness, the sluggishness, the impaired nutrition, the menses that become, initially they have no menses and then suddenly they have heavy bleeding. That is a typical thing of calcarea. So all these symptoms that you see in calcarea is very typical of a hypothyroid case, right? And also it has the anxiety. It has a lot of symptoms of hypothyroidism. So if a patient has hypothyroidism and is a calcarea patient, then it is calcarea carb will cover the pathology as well as the constitution. Calcarea floor. Now, calcarea floor will be similar to calcarea carb in the calcarea part, but it will have hardness of the gland first. Okay, it'll have stony hardness of the gland. There'll be calcium deposits or fibrous deposits. These fibrous deposits can be even in the thyroid gland. It can even be in the endocardium. It can be in any of the glands. Okay. And these patients are hot patients, unlike calcarea carb. Calcarea iode, like hydrastis, is a patient who has thyroid during puberty, like thyroidinum, but thyroidinum is a chilly remedy. Hydrastis is a chilly remedy. But if the patient is a hypothyroid case and the patient has got thyroid complaints since puberty, and the patient is a hot patient, you will give more preference to calcarea iode compared to thyroidinum or hydrastis. Okay. Even belladonna is a chilly remedy which has thyroid complaints from the time of puberty. So we get a lot of these cases where they say, we were very thin, we were very, very thin. And suddenly in 10th or 12th, we started gaining weight and we gained a lot of weight. And that time we had a lot of menstrual issues also. And that time I got PCOD. These cases which have ailments from puberty, you have to investigate it more and confirm that the patient is a thyroid case, because that's one of the switches that happen during puberty, right? There's a sudden switch in the amount of thyroid that the body needs, okay, the requirement and the demand from the thyroid gland. So these patients will be typically calcarea-like, but they will be hot and ailments from puberty. They'll have adenoids. They'll have recurrent cold and cough. Calcarea floor will have more glandular complaints, more heart complaints, more bone complaints. Calcarea iode will have more glandular complaints. Okay. Carboanimalis. Again, you can see these are meant for patients who have a cancerous diathesis. Scrofula is actually a tubercular diathesis with skin complaints. So the scrofulous means a person who has lymphatic involvement. Scrofulous also means a person who has skin ailments. So you'll find these two kind of tendencies in the patient with goiter. And you will find the carbon component. You will find the weakness, the heat, the burning, all the symptoms of carbon in this particular patient also. Carbonium sulf. Now, carbonium sulf, for some reason, is a remedy I really prescribe a lot. And this is not just for gout. I use it for so many things. It's almost like a, how can I say? It's almost, I think it is a new generation remedy and we should use it, and we don't use it as much as we should, because I have treated and got very good results in cases of neurological deficit, paralysis, deafness, tinnitus, diabetic neuropathy, you pancreatitis. I mean, there's so much that carbonium sulf covers. It covers the eyes, it covers the ears, it covers the tongue, it covers the stomach, it covers the all the different nerves, hypersensitivity. It is something that I use as much as I use Plumbermet. Okay, so and I think that maybe it is the pollution in the air, or I don't know what, but carbonium sulf really is a very indicated remedy for today's day and time. And I would really suggest that everyone learn it a little more, because it is a very effective remedy. Yeah. Cardismar. Cardismar is the remedy for venous goiter. So in venous goiter, you'll find the blue veins that will engorge the goiter, and there'll be goiter but with venous engorgement. So in this, will you feel the pulsation? No, because it is venous. So venous pulsations cannot be really felt as much as an arterial pulsation. So when you see vascular goiter, like you saw in Apis mel or you see in Jaborandi, that time you will feel the pulsation on your fingers. Okay. But in venous goiter, you'll see the bluish, like varicose veins. So you'll see the bluish tinge that will go across, and you'll see the venous engorgement on the goiter. Chelidonium, being a right-sided remedy, it has a left-sided goiter. Remember, we covered aurum, which had a right-sided goiter. Now, I've written only one thing here, right? But please understand, we will not prescribe it on just that. Oh, left-sided goiter, give chelidonium. No, we cannot do that. We will be seeing the patient as a whole, seeing whether the patient has desire for hot drinks, seeing whether the patient has pain in the right side of the shoulder, or to the inferior angle of the right scapula, or there'll be some other indication of chelidonium which will come up, the sleep symptoms, the dream symptoms, the mentals, or the history of jaundice. There will be something that will first indicate chelidonium. But we then should see and confirm whether it has a left-sided goiter, and we then should confirm whether this is a possibility. And you can also look at it backwards, that you know all the remedies that are left-sided goiters, and then look at them in more detail. Okay. Chloralum. Should we think of gallstone plus thyroid plus chelidonium is equal to, but then cardismar will also come, no, Nisha? Yeah, when you go ahead, you will see a lot of some remedies which have gallstone and thyroid. And frankly speaking, all females who have an emotional cause, okay, will have gallstones and thyroid together. So I would maybe go through the whole book and see the materia medica that I'm sharing with you, and then think. But yes, chelidonium will be one of the remedies we will think of. It will be one of the remedies. There's no doubt about that. Yeah. So again, chloralum, there are just two things that I will keep in mind from chloralum. One is that, again, like amyl nitrate, it has goiter from grief. So again, see, if you see from my Materia Medica, you'll see it again. Natriumur is not there in goiter from grief. We know natriumur has goiter and we know natriumur has grief. But goiter from grief is a very different thing. The patient gets ailments of thyroid from the time of grief. So I would have given natriumur if I see the natriumur symptoms. But if I see something which is more towards amyl nitrate or more towards chloralum, I will give that more importance. Now, chloralum has something very peculiar. It is more in patients who are withdrawing their anti, what do you say, their sleep medication. Okay. So if the patient was taking medicines to sleep, tranquilizers, and then they start withdrawing it, and then they start getting sleeplessness from that. And if they have already got a history of thyroid, then we must think of chloralum. So two things that will keep me coming towards chloralum. One is goiter from grief, and the other one is sleeplessness. Okay. These are the two most important things. It has asthma and eruptions, and there's a lot there. But these two are what I will remember of chloralum. Now, remember when we were talking about Graves' disease, we were talking about tremors of the hand, fine tremors of the hand. If you can see, there are remedies which Boric has given us where there's goiter with tremors or goiter with Parkinson-like symptoms. So chromium acid and chromium sulf are also two remedies which are there for goiter with Parkinson's. Cistus canadensis. Now again, Cistus canadensis is a remedy for Graves' disease. And the goiter, which is the frequent diarrhea, which we're seeing here, is not frequent diarrhea. It is increased peristalsis because of the increased hyperthyroid levels. And due to that, the patient goes frequently for stool. So this is not that a patient who has thyroid complaints comes to us with diarrhea and then we decide to give sister scan. No, that's not the way it is. When the patient comes to us with hyperthyroid and one of the main disturbing symptoms is the frequent stools, then we will think of sister scan. Like for example, when I gave the patient cactus, it is because the most disturbing thing for her was the fact that she could not move around, she was breathless, and the second thing was the puffiness on her face. So depending on the most disturbing symptom, you will get entry into the case. Kunayam. Now, Kunayam, if you see, there's nothing here writing all the symptoms that you're seeing, protruding eyes, as if they were pressed out. This is exophthalmos. Then there is increase of goiter, anxious sensation of the heart, rapid action of the heart, at pressure at times in the precordial region. Then there's palpitation. There is frequent and profuse micturition, tremulous weakness after stool, nervous prostration. So these are symptoms of thyroid, but then they're actually a patient of Konheim. So here again, and Konheim is known as a glandular remedy, right? But we have to see that the mentals match with Konheim and the physicals match with Konheim. And if a case comes to us who has all those kind of symptoms and maybe has ailments from celibacy, then we should give Konheim a thought since it is a glandular remedy and it covers all the symptoms of hypothyroidism. Cratagus. So Cratagus is a remedy that has amazed me, and I still do not know it to the extent I would like to know it. Boric has given diabetes in children in Cratagus. It's the only remedy which has diabetes in children, which means insulin-dependent diabetes, right? So I have taken it in another way. When I have a patient who has insulin-dependent diabetes, I surely give Cratagus, because I know that this will surely have an action on the pancreas. Now here he has also mentioned children in exophthalmic goiter with epileptoid seizures. So Cratagus is also again meant as a child remedy. It is a child remedy for children who have got complaints with the thyroid or with diabetes, and obviously these children will be of a syphilitic kind. Crotalus horridus. So exophthalmic goiter, when traceable to any exhausting or toxemic cause, such as overlactation, excessive or suppressed menstruation, amblyopia caused by grief, and overuse of eyes in sewing, cutting pains around eyes, muscavolitants, and various colored flames, retinal hyperesthesia in debilitated, broken down, strumous and hemorrhagic constitutions. So basically in this patient, I would think of it like this. If I see a patient who reminds me of phosphorus, okay, where the patient has eye complaints, overuse of eyes, grief, hemorrhagic diathesis, and ailments from loss of vital fluids. But since the patient has got goiter and the patient is hot, I will think of Crotalus horridus also. Ephedra vulgaris. Again, here you see exophthalmic goiter with cardiac action, action on the heart. Now, here they've written compared to Lycopus. In Lycopus, what I have noticed is the person has got hypothyroidism with hypertension. In Ephedra vulgaris, it is hyperthyroidism with hypertension. Am I making sense? Yeah. Now, this is something I've used a lot. Ferrum met and ferrum iode for ailments from suppressed menses, exophthalmic goiter after suppressed menses. Now, when we talk about suppressed menses, it can also be ailments from a hysterectomy, ailments from menopause, or ailments from suppressed menses. All these show a reflex action on the thyroid after the menses have stopped. Of course, ferrum iode is hot, ferrumet is chilly. Ferrum iode has intolerance of, what to say, hunger. And I don't know about ferrumet. Desire for bread will be in both. Ferrumet shows sterility. Ferrum sulf. Nisha, we have one more here. Goiter with pain in the gallbladder. Again, a hot remedy. Let's see if I can show you case 3. Oh, yeah. Now, this is a case I'm sharing, which was very interesting because this patient was, you know how we say, oh, we are available online, and if you fall sick, then you can take medicine from us with an online consult. Now, this patient has been my patient for quite some time. So this patient stays far away and used to take consultations on the phone very often. So they also were very uh, fluent with the homeopathic medicines. Okay. And she came to me and she said that I have got fever with pain in the throat on swallowing. And we thought it's a case of pharyngitis. She had taken Heparcel, Phytolacca, and this pain was extending to the ear. Huh? So she took Heparcel, Phytolacca, lachesis, nitric acid. Then she took a course of antibiotics. Nothing was helping her. The fever was not going. It stayed at 104 and nothing was helping her. So at that time, we said, okay, now we cannot do this online. We have tried everything and exhausted all our understanding of the case. You please come, let us examine you. So she came to the clinic, and to our surprise, when we examined her, she had this huge swelling of the throat. And it was more on the left-hand side, and they were enlarged cervical lymph nodes, and we could feel it was hot. Okay. Now, it had been around 20 days that she had already had fever. There was this pulling pain, the throat was tender, there was pain on swallowing. Uh, the temperature was 102, pulse was 104, 140. Okay. And she was so hot that the bed also underneath her would get hot. And she had a lot of profuse salivation. Now, profuse salivation is there also in Phytolacca. It's there in... So anyways, but none of those remedies had worked. Hot patient. The fever started with chills, and the chills started from the leg and it would travel upwards. Soon after that, the chill, there used to be a heat stage. When in fever, the fever would increase, and the throat pain would increase with the fever. And there was this pulling pain, and then she would get sleep very late at night. She had nausea at the sight and smell of food, worse in the evening, burning in the throat, and if I touch, there is pain. The goiter was hard and more towards the left-hand side, and there was severe pain in the thyroid region. It was stony, hard, and there was sweating on the neck. When we were examining it, there was sweating on the neck, warm to touch. Even the sternocleidomastoid was swollen. Okay. Sticky sweat along with the heat. Trembling tongue. White, yellowish coated tongue. Sticky sweat. So the patient had a clammy sweat. And she had vertigo and palpitations. Now this, of course, we came to know all this thing because when she came, we examined, we saw she had goiter, and then everything, the entire, perspective of the case changed. Okay. So then we sent her for a USG, and we sent her for her blood test and did her anti-TPO ATG levels. We did her thyroid levels, and she came with an acute infection of the thyroid gland. Okay. Symptoms of the disease. She had fever, swelling of the thyroid gland, palpitations, insomnia, and fatigue. The PQRS of the case: excessive heat, salivation, hard swelling of the goiter, severe inflammation and tenderness of the whole gland and adjacent muscles, and it was left-sided. So I consider this a very similar state as Merck. And because it was left-sided, and I felt we need to give iodine because it has to cover the goiter better. So we gave her Merck iod flavis. Now, please remember, we talked about ailanthus in the beginning. Do you remember? I spoke about ailanthus being a remedy for thyroiditis. So ailanthus has sensitivity to touch. If I had touched a patient of ailanthus on the throat, the patient would have found it very tender. They would have not allowed me to examine it. Okay, it would be so sensitive that they would not let me touch it. It would have been very painful, and painful inside also and outside also. Here we didn't find that kind of pain. Okay, there was of course pain on swallowing, but there was no pain on, there was no tenderness. So I have the reports with me. The pain, she quickly got relief, and her CRP levels dropped from 60 to 15 in 1 week, and the sonography improved. But I knew that this USG report is not going to get better very quickly, because these patients, once they go into thyroiditis, it takes some time for them to recover, and especially when their anti-TPO and ATG levels are high, it does take time to come down. So we did only one test of it, and then we left it at that. We just made sure it was coming down. So in this, the learning that I had was, when we were looking at throat infection, fever, 104, pain going from the throat to the ear, traveling to the ear, we had all other remedies coming to our mind, like Laccan and phytolacca and nitric acid and causticum and heparsulf. And there were so many remedies that came to our mind. But the moment we came to know the underlying pathology, the prescription changed completely. And this is what I want to share with you, that, sometimes knowing the remedy is covering that particular pathology gives you a better result in the prescription. Just see if I have it. I don't know whether you can see it. See, this was the anti-TPO. It was on 14th of October 2022. And you can see the anti-TPO 66.9. I just asked her to send it today only, so please excuse me. Yeah. This is her CRP, which was 15. This is her thyroid, which had gone to less, TSH had gone to less than 0.01. This was on 7th of October, 7 days before, where her CRP was 60.31. This is on 24th. This is after it got better. This is on 14th of October, where everything was enlarged. Yeah. So there were lymph nodes that were enlarged, and the both the lobes of the thyroid and the isthmus also were enlarged and heterogeneous. Okay. There was a cystic lesion in the right lobe even then. And these are the sizes. So basically from here, what I want to share with you is that if I had at that time to know the remedies like Elanthus, Mercure flavis, Mercure rubor. Yes, yes, yes. Yes, Dr. Chetan. Yes. For me, right in this particular case, I did give, if you can see that the patient had a right side cyst, but when we examined it, the the swelling was more on the, for us, we found the swelling more on the left. Okay, so that's when we gave the Mercure flavis. Huh? Yes, Mercure flavis is actually more for the right side. You're right. I was trying to get some more remedies from you, but for means sorry, some more cases for you, but for some reason I could not get it. Some more cured results. Just a minute. I've lost the PPT. Just a minute. I can't find the case paper. I tried to shift it, but I couldn't. I've been struggling for 5 minutes now.
पर यही तो डॉक्यूमेंट है.
No, this is not this thing. I want the PPT.
वो तो बंद हो गया.
वही मैं ढूंढ रही हूँ. सब उधर है. Okay. This is now this way, no? Okay. You were asking something. Yeah. What remedies should I think of if it's a male thyroid working started from overworking himself and feeling he is poor? How can we know for sure that a remedy does cover the thyroid? That's a very good question, Alet. Firstly, it can be male or female. There are no remedies that have been differentiated like that, unless we see that, okay, in our Materia Medica, they have mentioned a lot of female complaints along with the goiter symptoms. So if we see something like that, then we know it's a female remedy. Otherwise, all remedies will work on both male and female. The second thing is, if the person has started overworking himself and then started feeling uh, brania, okay, himself, and feeling he is poor, okay, and then you feel that you need to find a remedy. Are you sure that the remedy has come from the cause? Is that the cause, that the patient is feeling overworked and is feeling poor? You need to know whether that's the cause. If it is a symptom, this is not a symptom of thyroid, okay? That's a symptom or the cause. Do you feel that that is the cause because he felt he was poor and he was overworking himself, he got thyroid? Okay, so you need to, you need to first find the whole history of this patient, because there is right now no remedy that I know that has, okay, he collapsed when he was overworked. And is he chilly or hot? Okay. Is he obese or is he thin? Okay. Chilly and thin and overworked. Okay. So now, does he have hyperthyroidism or hypothyroidism? Hypo. It's very difficult for a patient to be thin and have hypothyroidism, okay? Hashimoto's disease, yes. So now this becomes a PQRS when the patient is thin along with Hashimoto's, because chilliness, overworking and collapsing, and the feeling of being poor will actually be a different section altogether. There is no remedy that I know of which will be a remedy which is for goiter, but then it has to cover the feeling of being poor, because these are not related to each other. Okay. But in such a case, we will have to look for a remedy which is exactly like this. You share the case with me and I'll help you. You find out the thermals, the thirst, the stools, the urine. If you can examine the throat, also the perspiration of the patient will be very helpful. Okay. and we can go through this, and maybe I should be able to help you. You can also give me a part of the family history if you have a good family history on the patient, because usually in cases where there is Hashimoto's disease, it is an autoimmune state. So there's a very strong anti-miasmatic state that is present. Okay, so the miasmatic ground. And sometimes it's not just one miasm, it is more than one miasm. So we'll go through the case together and I will surely help you on this. Okay. Now here I've mentioned, right, that we have goiter for fluoric acid, but you know fluoric acid, you know that the person will have. Yeah. So carcinosin, you share the family history with me, because carcinosin does work until they collapse. That is there. But then if it is driven out of fear, then, and if it is a delusion of being poor, then there are lots of remedies which are covering that, where carcinosin actually doesn't have that as a very strong point. Carcinosin's drive does not come from poverty. Yes, we should treat high TSH levels in pregnancy because we do not want IUGR, but we should treat it homeopathically. Yeah. Yes, we should. Now, fucus vesiculosis. It's a mother tincture that many people suggest for weight loss. It's a mother tincture that many people suggest for thyroid. And we know that is to be true, but there should be a combination of obesity, goiter, and constipation. So the patient is constipated, the patient has obesity, it has thyroid complaints, and the medicine has to be taken in spoonfuls. It does not work in drops. You cannot give 10 drops of fucus vesiculosis morning and evening and get results. No, it has to be taken in spoonfuls. Now, in my clinic, when this remedy is indicated, we give 100 ml bottle and we ask them to take 1 tea, and it's a very bitter medicine. So we suggest them to keep some honey on the side. You take 1 teaspoonful in half a glass of water in the morning and 1 teaspoon in the evening. Okay. Graphitis. Graphitis, the goiter feels lumpy to touch. There is choking on swallowing from the goiter, which means that, again, it's pressing on the isthmus, and there is a nodulated goiter. Okay. And again, you'll find the same symptoms of chilliness, the skin complaints, the dryness of the skin, the thickness of the skin, thickening of skin, constipation. These are all symptoms that are associated with hypothyroidism. So as you can see, the remedy may be a remedy which is constitutional, but it does cover goiter. Hall aqua. We have seen excellent results with this in the Bal Kalyan Sanstha organization over here for the physically and mentally retarded, where Dr. Sarkar comes here regularly and treats patients. And we have a few patients of cretinism or thyroid, which was undetected at birth. And the remedy that prescribes is Hall aqua. Now, Hall aqua has a tubercular diathesis and they have very small breasts. So if we see a patient of thyroid but has a tubercular history, Hall aqua is a very good remedy. We give it in 60 or 30 potency. Hydrastis. Again, tubercular diathesis, goiter of puberty and pregnancy, complications of pregnancy due to thyroid. Did you get your answer? So, Dr. Chetan, one of the good remedies for complications of pregnancy due to thyroid, okay, During pregnancy, you can give hydrastis, and hydrastis is a very good fattening agent. It is a remedy which helps the patient gain weight. Okay. Madam, I have seen cases of diabetes, hypertension, thyroid treated with homeopathy, but patient comes out of allopathic medicines. Then few months after that, stop homeopathic medicine, patient again becomes diabetic and thyroid levels elevated. I have used constitutional approach, anti-miasmatic and biochemic also. So I thought that the episode of some acute disease also can trigger that chronic disease. That's why this is happening. Am I right? Yes. Firstly, no thyroid is considered cured unless the patient is euthyroid for 3 years. Okay. So no, you do not treat a patient the moment the patient gets thyroid levels normal, you leave the patient. That is not the right way to treat thyroid. You have to continuously treat the patient for at least 3 years. I mean, sorry, you should continuously treat them even in spite of their thyroid coming to normal for 3 years. Okay. During that time, you have to manage their acutes. You have to give them their anti-miasmatics, give them their constitutional remedies, and continuously clear their layers of which they have built up over these years. So it is a very wrong practice to, first of all, wean the patient off allopathic medicine unless you know what you're doing. First, give them, if you notice in all the cases I've shown you till date, I have not stopped their thyroid medication. And they came to me in spite of taking thyroid medication. I do not stop it unless the patient shows thyroid states going back to normal and staying normal. You don't take a decision of reducing thyroid medication unless you're very confident about the results and unless the patient shows a consistent drop in the uh, thyroid levels. Now, I also mentioned to you that one of the main things that we see in our clinics are actually autoimmune, either Hashimoto's or Graves' disease. And in that, there is a fluctuation. So there are chances when the patient goes from hypo to euthyroid to hyper, or hypo to euthyroid to hypo to euthyroid. And that fluctuation is actually directly correlated to the autoimmune state that the patient has. And it is not our medicines that have given them cure. So the best way to treat a patient is to treat them while they're taking the allopathic medicine, get their symptoms all cleared, okay? And if their thyroid levels even then reduce to normal, then you keep on treating them and keep clearing the layers. Make sure that they stay with normal thyroid levels for 3 years before you stop your treatment. Have I answered your question? Okay, so we have discussed calcarea iode, belladonna, hydrastis for, yes, in diabetes and hypertension too. Dr. Chetan, I really suggest you go through my webinar of diabetes. I have covered it very nicely in that. Now, diabetes and hypertension also, you go through the same thing. And in diabetes, I go one level extra. I usually make them do all the tests. I find the cause for the diabetes. So I make them do their serum amylase, serum lipase. I make them do their C-peptide levels. I make them do their serum insulin levels. I do the whole test for each and everything before I decide how I'm going to address a case. And there are remedies for each and every state. each and everything that has been given to us. And what we do is when we do treat them from the root, and the root means the root, right? So we have to treat them from the level of anti-miasmatics. We have to treat them from the level of the constitution, and even using drainage remedies and pathology specific remedies. And then you can say that the patient is cured from the root. So even our diabetic patients, we don't treat them, and then the moment their HbA1c comes to below 6, we say, okay, fine, now leave our treatment. We don't do that. We continuously treat them, and we keep treating them and keep looking out for complications, because more than diabetes, it's the complications that are worrisome. And very few cases you'll get or maybe as you go in practice, as you go ahead in practice, you'll get very few uncomplicated cases. You'll get very few cases where the sugar has risen and they don't have any symptoms. You will find that, okay, it has touched the kidney, or it has touched the nerves, or it has touched the eyes, or the patient's digestion is spoiled. You will find symptoms that are complications of thyroid, and you have to address those too. Okay. So, in iodine, we see premature and too copious menses with goiter. Again, if you see, this is premature menses means early menses, right? Too copious. Also, these patients are, you know, the long neck of natrium urine iodems, right? You know that. And thin, hyperthyroid. So dwindling away of the breast, which we saw in Hall Aqua also. Great weakness on going upstairs, PCOD, painless goiter, and you see a goiter which is soft and then suddenly turns hard. Okay. Thyroid painful during menses. Paralysis of face after suppression of goiter. And cancers of the thyroid gland. These are some indications of iodine in thyroid cases. We know thyroid for all the other things, the appetite, the constitution, all this, but then you must keep all this also in mind, because this is sometimes the entry point to the case. Iodoform is rheumatism with goiter. Another remedy for rheumatism with goiter is thyroidinum. Iris versicolor. Goiter with migraine and diabetes and psoriasis. Now, I found this an eye-opening remedy because it is not used as much as we do. But I want to read it to you from Boric. Can you see? It says thyroid, pancreas, salivary glands, intestinal glands, GIT, the gastrointestinal mucous membrane, and it increases flow of bile, sick headaches, and cholera morbus are its therapeutic fields for its action. Now, in these cases, what I usually see is, there's one thing that is common between the salivary gland and the pancreas. That is your serum lipase and serum amylase. So in these cases, you will find pancreatic issues which have to do with the pancreas per se, okay, salivary gland also, and thyroid also. Okay, so in cases where I have female patients who have sick headaches or migraines, and along with that, they have diabetes and hypertension together, this is one remedy I give as a supportive treatment in such cases. Okay. Jaborandi. So Jaburandi, first of all, I had an amazing case of Jaburandi. The patient had crazy exophthalmos, and even the anti-TPO levels were very, very high. And when I touched the thyroid, it was just like, it was as if there was a separate heart inside the thyroid gland. So there is pulsation of the thyroid, and there is clamminess, there is excessive perspiration, excessive discharges of saliva, sweat, very similar to Merck, right? So there is excessive secretion of the special secretions, and it is a remedy for menopause. Now, in menopause, when the patient does not have hot flushes, but has a lot of sweating in flushes, think of Jaburandi. So we think of hot flushes as, we think of lachesis, right? What I've noticed is when the person starts suddenly sweating, profuse sweating, and thyroid, and the person is menopausal, think of Jaburandi more than lachesis. Now, Kali Carb, I've just written goiter. Laccan, I've just written goiter. But you know these remedies as constitutional remedies. If the constitution is covering goiter, is covering the patient, and then the patient also is coming for thyroid, there are higher chances of the efficacy of the remedy because the remedy does cover the sphere of action. Kali iode is a syphilitic remedy. So as you can see, there is a painful and sensitive goiter, and there is atrophy of the goiter. So this is the only remedy where you cannot feel the goiter because it is atrophied. But you will know it is there because the patient will find it painful when you go for examination. So here in these remedies, you can see that the patient has got lachesis is left-sided goiter with pain in throat instead of menses. Lapis is soft and doughy, and they're movable, non-encapsulated goiter. See, quinine, we know quinine has a rubbery sensation in the glands, right? The conine glands have a consistency of rubber. Badiega, we know, is a hard consistency. Calcarea iode, we know that that is with puberty and with pregnancy. Graphitis, we know that it has got a doughy look, doughy feeling. Kali iode, we know, is a shrunken goiter. Jaborandi, we know, will be a pulsating goiter. So the examination of the throat and the thyroid will give us indication of the remedy from there. Lycopus, we discussed it with, what was that other remedy? Pedra vulgaris, where there was hypertension with goiter. Yes. So Lycopus has hypertension, but with hyperthyroid. Okay. And these patients, sorry, hypothyroid, and they have hemorrhoids or bleeding piles. So ailments from suppressed hemorrhoids and which lead to goiter, think of Lycopus. In fact, there are lots of times when I find it difficult to differentiate between Lycopus and belladonna because both of them have hypertension with hypothyroid, and both of them have got very similar states. But belladonna, if you don't find the mentals matching, it's very difficult to give it. So you don't give belladonna unless the mentals also match. Okay. MAC-FOS, for those who had attended my biochemic webinar, I'm sure you'll know that MAC-FOS is one of the remedies which is very good for Parkinson's, and here it also covers goiter. Addison's disease. I think right now, a lot of us know that most of the patients are going through a lot of stress, and we have a lot of adrenal fatigue in the patients who we see. And then because of the adrenal fatigue, it affects the thyroid, and then they have hypothyroidism, which is originating from the actually the adrenal glands. Something like what Airlet said. So they're working very hard, lots of stress, lots of stress, lots of stress. And then they go into hypothyroidism from there. Okay. So this is also another search that I do, because I look for remedies which have stress as the cause for the thyroid. But of course, we go into details of that separately. Platina is the only remedy which has tickling and aching of the goiter. Worse on touch. Podophyllum. Goiter from right to left. Sepia is a large soft swelling. Spongia. So goiter with asthma. Again, we all know that spongia has a lot of iodine in it, and it is an iodine-rich remedy. And spongia has a particular goiter which grows upwards, and so there is no chin. So from the chin down, there is an enlargement, and you'll see that the neck is like this. The person does not have a chin. So that usually is a spongia goiter. And of course, with that comes snoring. Huh? I don't know whether you can see it. Hard swelling of glands. Large swelling with chin is written there. Stammering with goiter is in sulfur. Now, I'm going to talk a little about thyroidinum, because this is the remedy. Most people only use thyroidinum if it is a case of thyroid, which is actually not right. And at the same time, that's usually the amount we know in the beginning, and then afterwards we start learning the other intricacies of treating thyroid. Now, one thing that we discussed is cretinism, where there's a case of physical and mental retardation that comes to you, or even low birth weight. Think of thyroid disorders. And how you differentiate this from Down syndrome is that in Down syndrome, the eyes are very closely set. They have low-lying ears, okay? And in hypothyroid, you won't find that. You'll find regular eyes, you'll find regular ears, but the person has all the dwarfism that is there. Okay, so it is best to check a patient who comes to you for mental and physical retardation to see if there is any underlying thyroid issue. Okay, now these are tips that I took from Blackwood, which I thought you should think of. Hyposecretion is usually indicated by cretinism and myxedema, and many symptoms that are not as easily recognized. Cretinism is an absence of the thyroid or its secretion in infancy. With a subthyroid secretion in young children, there is slow growth and a general lack of mental and physical development. With these, the skin is dry and at times simulates ichthyosis or eczema. So the skin is so dry that it looks like ichthyosis or eczema. There may be amenorrhea, chlorosis, hysteria, nausea, and vomiting. Epilepsy may develop in these cases during infancy, puberty, or the menopause. Melancholia, adiposis dolorosa, and obesity may develop at the menopause. Now, this is all what Blackwood writes, and I'm just repeating it, okay? Infantile obesity often requires thyroid in combination with small doses of pituitary. These patients may require small doses of thyroid at puberty. If menstruation is too profuse, mammary extract should be remembered. Nocturnal enuresis may be annoying when small doses of the thyroid alone or combined with pituitary often benefit. Subsecretion of the thyroid is met with in cases of amenorrhea with muscular weakness, sleepiness during the day, or more or less muscular weakness, digestive disturbances, and tendency to deposits of fat about the body. This condition is noticed often about the menopause. Myxedema is a common condition if looked for, and small doses of thyroid is the remedy. It must be kept up. Epileptic attacks are often benefited when there is evidence of a subthyroid condition. Now, I want to share one thing. Epilepsy without fever, one thinks of thyroid more. In children, if there is epilepsy, but there is no fever in it, if it's not a febrile convulsion, think of thyroid. Hypertension is benefited by thyroid when there is dry skin and evidence of senility. Also, asthma and constipation of the aged. Goiter at puberty, pregnancy, and menopause. Moist patches behind the ears heal up. Swelling of face and hands. Burning sensation of lips with free desquamation. This is all psoriasis, okay? So one of the indications of thyroidinum is psoriasis, okay? Increased appetite with improved digestion. So they have increased appetite and improved digestion, means they'll either have diarrhea or constipation. Sleepiness or sleeplessness, diabetes, obesity, psoriasis, eczema, arthritis, psoriatic arthritis, chili, desire for sweet, and scleroderma. All these can be treated by thyroidinum, which gives very good results. And this I can also confirm because we've been using it since the past 5 years. And these are really good indications for thyroidinum. Okay. I hope I don't lose this again. Okay. Oh, oh, oh. Yes, 4 is not here. Mhm. Okay. So yeah, in this, these are A little bit of diet that I've added. Now, I'm not going to talk about diet the way a dietitian will talk about it. These are basic things that we as homeopaths should know. So I'm sharing it with you. So iodines as a crucial element for thyroid health, uh, as it is required for the production of thyroid hormones, especially T3 and T4. These hormones play a vital role in regulating metabolism, growth, and development. Okay. So thyroid is needed, but not too much, right? Soy products, they contain goitrogens, which can interfere with the thyroid function by inhibiting the uptake of iodine. Okay. Another thing that is a goitrogen is all the cruciferous vegetables like broccoli, cauliflower, cabbage, Brussels sprouts, things like that. Which potency should we use generally for thyroidinum? So Nisha, I use all the potencies of thyroidinum. I use 6x, 6E, 30, 200, 1M, 10M, LM potency also. It really depends on the case. Now, the more functional the thyroid is, the more lower I go in the case. If I find an allergic case where there's a history of thyroid in the family, and the patient has allergic rhinitis or allergies with a family history of thyroid in the mother's and the father's side, and the person is chilly and has desire for sweets, I will give thyroidinum in 60 potency, and it works beautifully. You must try it. Thyroidinum 30, I give, or thyroidinum 60 and 30, I give for patients who have issues with allergy. Thyroidinum 0 by 1 onwards, I give for cases where there I see psoriasis, where I will have to give a repeated repetition of that remedy. Okay, so I keep playing with the potencies. You must find your own way in that. If you want a case to case, I can maybe help you. In repetition needed once we start tapering them from allopathic thyroxine. Yes, so in that usually our teachers have taught us to give a single dose in centesimal scale while we are tapering off the dose of thyroidinum. So like if you're giving L-troxin and you want to taper it down and go from 50 to 25, then you can give a intercurrent dose of thyroidinum 200 and then reduce the dose. Okay, so we give that as an intercurrent. See, the more you ask, the more you'll get. So I really encourage you all to ask me questions, because then I may give you something more practical than what is given here in the webinar. Iron supplements. So iron supplements, multivitamins, these that contain iron, they interfere with the uptake of iodine, and they also interfere with the uptake of the thyroid medications. So it is always suggested that you keep a gap of 4 hours if you have to take iron supplements or thyroid medication. Same thing goes for calcium supplements. Okay. Role of selenium. Now, selenium is a trace mineral found in that plays a crucial role in thyroid function. It helps the conversion of inactive thyroid hormone T4 into the active hormone T3. Okay. So here in homeopathy, what I do is I give them selenium 6x as a supplement. Especially if I see patients with graying of hair, hair fall, weakness more in the summers, or sexual weakness, then I give selenium 6x as a supportive treatment to the cases of hypothyroidism. Magnesium. Now, magnesium is also a remedy which is, is a salt which is needed for over 300 biochemical reactions of the body, including the conversion of T4 to T3. Okay, so here again, if the patient does not have enough magnesium in their body, they will have a decrease in immune function, they will have inflammation, they will have sleep insomnia. So all these are again part of the autoimmune thyroid conditions. So if I find a case of hypothyroidism with fatigue or muscle weakness or brain fog, I will give MACPHOS 6X as a supplementation to these cases. What should be done if all the symptoms subside but no change in the pathology count? That's not possible, Dr. Amit. If it does happen, then I would give an anti-miasmatic or another constitutional remedy. So usually it doesn't happen. But if it does happen in any case, think of obstacles to cure, right? We are taught of obstacles to cure. We are taught about miasms. Then there will be a very strong, deep-acting anti-miasmatic which is needed. Please go back into the family history. Okay, so I have spoken about MAG-FOS 6X and selenium 6X as a supplementary treatment for all these cases which we are seeing. So in homeopathy, if you want to support the thyroid gland, you can give MAG-FOS 6X and selenium 6X to your patients with it, instead of giving thyroidinum 6X, which has to be decided whether the patient has the indications of thyroidinum or does not have. Like if the patient is a hyperthyroid, you can still give selenium and MAG-FOS, but you cannot give thyroidinum unless the indications are there. Okay. So now I'm coming to the tips. I think this is the best part. So as I told you, thyroid with weakness, you can give MAG-FOS 6X and selenium 6X. They're both good, and they're ones that you don't have to think, but you know that hypothyroidism does cause weakness already, right? So your remedy, if it is a good remedy and if it covers the patient's symptoms properly, the weakness will automatically go. Okay, so here are the tips. Thyroid since puberty, think of belladonna, hydrastis, calcarea carb, calcarea iode, and thyroidinum. Thyroid since pregnancy, think of belladonna, hydrastis, and thyroidinum. Thyroid at menopause, think of jaborandi, thyroidinum, ferrum iode, ferrum met, iodum, frutalis horridus, and lachesis. In examination of the thyroid, pulsating thyroid was jaborandi, venous was cardamom, painful was ailanthus, aurum iode, kali iode, and platina. Platina was also ticklish, if you remember. Soft and then becomes very hard is iodum. So you will find soft thyroid goiters will be calcarea carb or iodum. Nodular is graphitis and phytolacca. Lumpy again is graphitis. Hard is calcarea iode, calcarea fluor, badiega, aurumunat, bromium, baryta iode, and spongia. Shrunken is kali iode. Swelling up to the chin is spongia. Right side is aurum iode and lycopodium, phosphorus, and Merck IF, right, Dr. Chetan? Okay. And right to left is podophyllum. Left-sided, chelidonium, lachesis, and Merck IR. Actually, that's the right way to remember it. And that's how I used to remember it. That R, the opposite of R, or is left. So that's how Merck IR is actually for left-sided and Merck IF is for right-sided. Ticklish is platina. So on examination, if the person is ticklish to the goiter, then the remedy is platina. Necks, thin neck, natrimur iodum and the iodum salts. Emaciated downwards means either flat-chested or small on top and large thighs and big buttocks. Then you think of lycopodium, natrimure, phytolacca, and calcarea carb. Emaciated upwards, lycopodium, argentum nitricum, abrotanum, and pulsatilla. Thick neck, ammonium salts, belladonna, bromium, calcarea, apis, graphitis, kali salts, and merc salts. Flat or shrunken breasts. In this, you must add laccan, iodum, hall aqua, and laccan. Gray hair or hair fall from thyroid complaints. Think of thyroidinum, natrimure, sorinum, thallium, and selenium. Okay, when you're measuring the neck, if anything above 13 inches is thick. You see, you can feel it. When you do this, you will see it. In patients with thick neck, you can't do that. You'll feel it, but then your hand will touch the shoulder directly. You know the people who look funny when they wear their collars, when they button their collars, those are thick necks. But keep on an average. I'm not talking about small children and big children and adults. In adults, 13 inches is okay. Anything above that is thick. Past history or family history of tuberculosis and the patient has got goiter, please give an anti-miasmatic, at least single dose of Drosera in a very high potency to clear it. That goes for this one who was asking me, what if there is no change in the pathology count? Please think of Drosera. History of too many hormonal treatments and that causing thyroid, please think of Aristolochia clematis. Thyroid issues with history of too much medication, think of Crotalus horridus. Acne with oily skin and thyroid complaints, think of selenium. Sleeplessness in thyroid, belladonna, chloralum, and thyroidinum. Also, if the patient is weaning themselves off sleeping pills, think of chloralum. Goiter and the C. We find a lot of these, right? Every ameliorated seaside, aggravated seaside. So I'm just giving you this, just food for thought. So seaside amelioration is lycopus, iodum, natrimure, medorinum, and bromium. Okay. Where asthma is ameliorated at sea and worse on land. Worse near the seaside is aquamarina, amyl nitrate, and iodum, which has burning worse at the sea, but it's otherwise ameliorated in the seaside. Natrimure has bad effects of sea bathing. If you're looking in MAC repertory, look for these keywords: goiter or Morbus Basedowi or Basedow's disease. These are words that were used in the olden books, and these all come to the same conditions of thyroid gland. Okay, I think I'm done. Yes. Any questions? I have failure in cases of hypothyroid where only presentation was dyslipidemia and constitution was given. Any specific pathology remedies we can give in such cases? Nisha, consider it as a full-blown hypothyroid case. So when you're seeing a patient with dyslipidemia, think of the patient, whether like how Ayet put it, whether the person is thin or fat also, because sometimes you find dyslipidemia in thin patients, and then the remedy completely changes. And if the patient is fat, then again the remedies will change. Is there any remedy for skin white discoloration after use of clobetasol? My God, this is suppression, and these are very difficult cases, Dr. Chetan. I struggle with patients who have used such medication for the leukoderma, because they come back with even more aggressive leukoderma when they have suppressed it. In such cases, I would really recommend that you go and give anti-miasmatic or constitutional remedies, because nothing on the pathology level will this thing. You can give a few doses of zinc met or something to clear the layer of suppression, but it's not going to cover the case completely. How to know that a remedy does cover thyroid? See, that's why I shared all these remedies with you, because I don't know any place where they've written thyroid and given such an extensive materia medica for thyroid. And that was why there was a need for this webinar, because I was covering thyroid from a lot of source books, and every author writes according to their experience and knowledge. So every author's experience and knowledge is different. And when you collate that data and put it in one place, that becomes a little more extensive and expanded. That I would suggest that you use the materia medica that I've given you right now. Besides that, I have also given you the symptoms in the beginning of the webinar, where I have told you the symptoms of hypothyroidism and hyperthyroidism. And those are the symptoms you have to look out for in the materia medica to know if the remedy is covered by thyroid. Okay, I'm glad you're asking questions. Trying to. In cases of overdrugging, which potency of crotalis, chloralum, or how long, and do they work as drainage remedies? So here I have yet not used these remedies for as drainage remedies, so I wouldn't know how long to do one. But my suggestion is, Katyayani, you use chloralum until you see the sleeplessness go away. One, if the patient's sleep symptoms go away, don't give it. Crotalis, again, you look for the symptoms of crotalis, maybe the hemorrhagic tendency or the flushing, or you have to look for the symptoms. Once the indication goes away, you stop using the remedy. That's the way I do it for most of my cases. What medicines are blockbuster to think when penicillin injections are given to for months in RA in childhood and then presenting with goiter? Wow, amazing. I am so glad you picked up this topic, because I have not shared this remedy with you in this thing. Now, see, penicillin injections, in this case, no, Dr. Nisha, I would first of all give penicillin in potency, and I would have looked for, so the remedy is parotidinum. Okay. You can also give streptococcinum. Okay. I will just share that with you. I'm so glad you asked this question, because I would have missed out on this point. Just 1 minute, huh? I'll just share that with you, because I'm glad you asked this question. History of I think it'll be here, parotidium. Here they are discussing it with diabetes as a history, with a history of parotitis. But I also have, I'm trying to look for it. But parotidium is the remedy for what you're saying. I'll find that and I'll share that with you. But you do get penicillin in centesimal scale. What were the investigations for diabetes and homeopathic indications of the investigation? Dr. Chetan, I still don't know any medicine that is there for the bad effects of pneumocozole. If I do find, I will surely share it with you. But till date, we have only tapered down the medication and then treated them symptomatically. And usually the thyroid and if the antibody levels are going down, we are fine with it. So I've never had to treat the side effects of pneumocozole or thyroxine for that matter of fact. The investigations for diabetes. So I use serum insulin, fasting PP, C-peptide levels, fasting PP, BSL, fasting PP, HbA1c, glucose in urine, of course, the whole urine routine with the estrus levels. Then I look for cortisone. So cortisol levels at 6 a.m., 10 a.m., and 4 p.m. That also helps me in finding out the circadian rhythm of the patient. Serum insulin, fasting PP. Yeah, these are the main ones that I check. And LFT. Yeah. And if I find fatty liver in the USG, then I take that into consideration as insulin resistant diabetes. I mean, Dr. Chetan, please try seeing the webinar. I have given a webinar on diabetes and I have discussed this in detail in that webinar. Just trying to find that one. Here I can find pancreas, but then I can't find thyroid. Here ailanthus is coming up. Bromium is coming up. Yeah. But parotidium is a very good remedy for metastasis, from one gland to the other gland. Any other question? It's been really nice. I really like it when you'll ask questions and interact. I find it much more easier. I will come back to you and I will go through that case with you and suggest whatever remedies come to my mind. Is there anything else you would like to ask? You're welcome. Is there any topic you all would like me to cover? I'm sure you'll have seen all the uh, webinars that I have given, means at least the topics. So is there anything in particular that you all would like to learn or study together with me? Any role of parathyroid? Yes, so I have used parathyroid hormone a lot in my kidney cases, more than in my thyroid cases. So, but parathyroid is directly related to vitamin D. So, usually when we look at parathyroid as a sarcode, I usually look at serum calcium levels, I look at arrhythmias, I look at cramps, mostly very intolerable cramps at night, and kidney issues, spasm of the urethra, spasm of the renal artery. All these are very well taken care of and treated by the parathyroid hormone in potency. Uh, yes, of course, Dr. Amit, that's the entire idea. Please add yourself, message the clinic group, and we will add you to the study circle if you're not there yet. And as much as I can, when you have a case where you're stuck, I try to help you with whatever I know. There are times when I don't know too, but whenever I do, I will surely help you out. How do you give centesimal potency in water, 1 globule or 4 globules? Which number and how much dosage? So, Dr. Chetan, it really doesn't matter. But then I'll tell you what I do. I do centesimal scale. I put sometimes uh, if it is something where I'm giving the patient something from my clinic itself, I can give something depending on what I have it in. So sometimes I give it in poppy seed, sometimes I give it in 40 number size globules, and we put that in a 1 ounce bottle and mark a half on it. So in that, we put a little bit of alcohol, lots of water, sterile water, and then we put the dose inside it, suckus it, and drink half, keep half. That's how I do it for centesimal scale. And 1 globule or 4 globules, it doesn't really matter. But if you want to make it more effective, the lesser, the better. Mother tincture is useful in thyroid. As I said, we used mother tincture was fucus vesiculosis. But more than that, we use the biochemics. So the MAC-phos, selenium, even these remedies which I'm sharing with you, almost all the remedies that I've shared, iodine, I use in mother tincture form for patients with uh, hypothyroidism, where we want them to have we want to reduce their appetite. But you don't give that much. You give only one single drop. Okay. Spongia is also an excellent mother tincture. But then spongia I've used only once or twice. And of course, that is when the cough and the other symptoms were indicated. Yes, yes, please, Dr. Amit. You're welcome to the group and I will surely help you in that. So the thyroid mother tinctures, all these remedies which I've shared with you right now are remedies you can use in thyroid cases. Phytolacca, I have seen a very good result when I've given Phytolacca D, Decandra, in cases of thyroid with rheumatism, and it also brings down the weight of the patient. It actually can be used more. I don't know berry as much as D because I didn't get a lot of information on Phytolacca berry. So I was and I didn't know the way it works, the pathophysiology behind it. So I have kind of not used phytolacca B, but I have used phytolacca D, and I'm very happy with that, with the results of phytolacca B. Any other? Share with me, suggest if there is any topic you all want me to do, because I'm open to it. I'm right now working hard on studying miasms, and hopefully I'll be able to share something uh, a little more comprehensive. I'll be covering theory of chronic diseases and J.H. Allen, but more so theory of chronic diseases, because I think that is the most important book. I've read it, but then to compile it into a webinar is a different thing. If there's anything else you'll want me to share, I'm open to suggestions. Okay, done. Fibroids, myomas, and polyps. Female remedies. Sure. Actually, that's a very, very good topic. Okay, yes, Aliza, I really want to teach miasms. I have done miasms in my first few lectures when I was teaching case history taking, but more so I want to do it from theory of chronic diseases. So I give you all something which you can completely base your prescription on, and I'm hoping to do that very soon. Dr. Burnett's work on So, Dr. Burnett's work is only what we've been studying all this while. In fact, most of our inspiration comes from Burnett. Cough and respiratory diseases. Tumors. Tumors, my God. No. I think I'll do that maybe 5 years down the line. I am still not that good at tumors, and I have to see more cases to even feel as if I can share something with you all. So no, I will treat and cure, and then I will come back and share. Tumors right now, it is going to be difficult. But cough and respiratory diseases, I have done, but I'll do it. I'll do it again if you want. I've done it. I've done it. Yes. But I will do on fibroids, as you said. Fibroids, polyps. Pediatrics, I have done. Pediatrics, I have done. Pediatrics is in fact, I think, so I'm a mother of 3. So after handling 3 children, I think, yeah. I've done a good job with the pediatric webinar. You can learn a lot from it. But from here, I think the one that I have not done is fibroids, and I will surely get down to doing it. Anything else? Any questions? For those who are newcomers to my webinars, I would really suggest you all go through the first webinar of mine, which was on case history taking. It will give you a great insight into constitution, miasm, your pathology specific remedies, how to take a case, what is important, certain indications. Like now in the end, I gave you those tips. So there'll be a lot of tips, a lot of things that will help you in understanding how to take a history. If you can take a history, it's easier for me to prescribe, because that's the biggest worry I have when I'm prescribing for your when I'm trying to help you all reach a prescription, but you all give me information, but I find it too little for me to prescribe. It gets very difficult. We take very long histories, and we take very detailed histories to reach a prescription like this. We don't do these shortcut prescriptions. Of course, it looks like that when I'm teaching it, but then that's not the way it is. We take very, very detailed histories and try to find out exactly what the pathology is. So please go through my case history taking format so that you all can help me in asking me questions which I can answer. Yes, I will surely do miasms. It will take me some time, but yes, I will do miasms. For conquering book, the conquering thyroid, I will. Can you just send a message to my clinic number and I will get back to you on that. Yeah. And it was really a pleasure. I'm so happy to see new people join, and I really hope you all can take back something from here and use it in your clinics. Please share with me your successes when you use whatever you learned in this webinar. Please share the problems you'll face when you'll use my whatever I taught in the webinar. I will also try improving from it, and I will also try covering the gaps that I must have left while teaching thyroid. Yeah, I think we'll call it a day. Thank you very much. Thank you, really. Thank you very much for attending it, and hope you all gain a lot from this, and hope you all get very good success in your cases. Thank you. Thank you, Nisha. Thank you, Dipti. How to convince a patient to take medicine for 3 years? Tell them that that's the way it is, even in allopathy. In allopathy, it's for the whole life. For us, it is 3 years. Yeah. Okay, if you all want to still keep in touch, please just contact us on the clinic number where you all have been in touch all this while. Thank you very much. Katyayani, I am so grateful, and it's so sweet of you to attend this webinar in spite of learning so much from Dr. Dhanukar and Dr. Borkar. It is very sweet. I loved having you online.